Hello, everyone. I'm Barbara Ham Lee. It's the fourth Friday of the month, which means it's time for another view on health with Dr. Keith Newby. Today's topic, high blood pressure. Are you on high blood pressure medication? Would you like to get off? Dr. Newby talks to us today about this silent killer, what it is and what it does, plus traditional and non-traditional ways to manage it. We want to hear from you at 440-2665. And today is also the last day of our Spring Pledge Express campaign. So if you love Another View, we need to hear from you now with your support. It's Pledge Express. Let's go to Pledge Central to see just how we're doing.
Thanks, Barbara. It's going great this morning. We're at $20,098.
Discussing the issues and celebrating the successes of the African American community. This is Another View.
And good afternoon, everyone. Happy Friday. I'm Barbara Ham Lee. Welcome to Another View. Now, Another View was preempted last week for extensive coverage of the Boston Marathon bombings. We were expecting to talk with Judge Eileen Olds about her new book, Twin Expectations. The great news is we've rescheduled her for the first Friday in June, so you still will get an opportunity to hear that show. A couple of other things before we get into our discussion today. Maya Angelou was scheduled to be here in Hampton Roads on Thursday, May 2nd. She has become ill, and her doctors will not allow her to travel, so that show has been postponed. It has not been canceled. It has been postponed, and as soon as we get the new date, we will let you know, and then we will give away yet another set of tickets that we have for that program. So Maya Angelou, not here next Thursday, May 2nd, but hold on to your tickets for the rescheduled date. And then I also want to say a very special shout out this afternoon to my granddaughter, Miss Patience Ham. She is sitting in the studio. She's 3 years old, and she wanted to see what Grandma does every day when she comes to work. So we're very excited to have Patience here visiting with us from Baltimore. So hi, Patience. So blood pressure or hypertension happens when blood pressure, the force of blood pushing against the walls of the arteries as the heart pumps blood, rises and stays high over time. Now, it can damage the body in many ways, but there are ways to control it, and in some cases without medication. Cardiologist Dr. Keith Newby is here to answer our questions today about high blood pressure. Dr. Newby, welcome.
Good afternoon, as always.
Always great to have you on the fourth Friday of the month.
Well,
thank you so much.
Thank you. And I'm looking at your beautiful granddaughter sitting in the area over there. She's wonderful. She says she's 3.
Thank you. She's 3 years old. Yeah.
You look too young to be a grandmother.
Oh,
What's
you
up
are
with
so
that?
sweet. I appreciate that. So, and this grandmother has her own high blood pressure medicine. I even brought it in to show you on something called Tribenzor.
Yeah.
There's so many different types of medication, so many different things we can do. But let's talk about why people in general have high blood pressure, and then also why it affects African Americans so much.
Well, I think the first thing, if you give me a moment, let's talk about what is hypertension. Okay. And you know, a lot of people don't realize there is a difference between high blood pressure and hypertension. And I think that's something that we need to clarify first. When you hear the term hypertension, that's a chronic problem, meaning that it's sustained and ongoing. The definition of hypertension is if your top number, you get the top number, bottom number. The top number is called the systolic blood pressure, and the bottom number is called the diastolic blood pressure. If your top number is 140 or greater, or if your bottom number is 90 or greater, that is considered hypertension. You have to have that 3 separate occasions when you have your blood pressure checked. If it meets any of those criteria, that's the definition of hypertension. High blood pressure is more of a transient problem, meaning, say, and I always love to use this example because most people can relate to that. Say you're sitting at your desk on a Friday afternoon and you just finished your show, and all of a sudden your phone rings and somebody's on the other end and says, Barbara Ham-Lee, this is Joe Blow from the IRS. So we were reviewing your records.
Yeah,
and
we would be having a heart attack right about
and we saw that you owe us $500,000 in back taxes, and we need this by Monday a.m. And I check your blood pressure an hour later, or even a few minutes later, I guarantee you it's going to be quite elevated. That is more of a transient issue from emotional stress. It may have been something you've had to eat that day, and we'll talk about that as well. Mm-hmm. But there are other things that can transiently raise your blood pressure. That's not a permanent problem, and you could check it the next time. It's totally normal. Some people come to the doctor and they get what they call white coat syndrome, which means their pressures go up
because they get nervous because they're sitting in the doctor's office.
Exactly. Mm-hmm. And any other time, it may be totally normal. So those are the things that can transiently raise blood pressure. Is why we talk about doing it on 3 or more separate occasions, so you can clearly see it as a chronic problem.
Mm-hmm. How early do you need to start having your blood pressure checked?
Oh, I would say, it depends on your physical condition and status. If you're deemed overweight, or if you're deemed as having a family history of hypertension, I think really, I've seen patients 15 years of age and less with hypertension.
So even teenagers and young people.
Yeah, I think everybody should always have at least a yearly physical. And especially if you're young. Because you pick this stuff up early. Mm-hmm. A lot of times people, young, and I understand. I was young once, and I know how it feels to think you're invincible. There's never going to be anything wrong with you. I had a cousin that was diagnosed with hypertension when he was 15. So I have personal experience with that to know that it does occur young, and so I think everybody should be having, even young children should be getting physicals and mm-hmm. Evaluations. And I don't think there's any really age limit, but normally I haven't really personally seen it less than 10, but I'm not a pediatrician, so I don't have that experience, but I have seen in the young teenager years, I've seen people develop hypertension then.
Mm-hmm. 440-2665 or 1-800-940-2240 are the numbers to call to join our conversation today. We're talking about hypertension and high blood pressure. The number again, 440-2665 or 1-800-940-2240. So you go into the doctor's office, you've had your 3 different times checked, your numbers are higher than 140 on the top, higher than 90 or higher on the bottom. The doctor says, we need to put you on medication.
Well, it can be, there's different ways you can approach this at first. I think the first step, for me, it depends on how high that pressure is, says, whether or not I would discuss with the patient about medicine first versus lifestyle change. Okay. If you look at most data that says if you're overweight and you're really committed to doing this, they say even a 10-pound weight loss can affect your blood pressure by 10 points, 5 to 10 points. So you can go from 140 to 130 just with a 10-pound weight loss. Now, if you're already, 150 pounds, soaking wet. If you're that, you're 6'2", I'm not going to advocate weight loss in that situation. Right. But I think if you're deemed overweight, then that may be the first step. And that's really a matter of how committed a patient's going to be to doing that. With salt reduction. If you look at a teaspoon of salt, is 2,400 milligrams of sodium. If you look at, the recommendations, say that if you drop that, gram, because people eat a lot more sodium than what they think. A lot of people,
a lot more than just shaking it on their food.
I get that all the time. Say, well, I never add salt to the food. I'm like, well, it doesn't matter. If you look at what types of foods are you eating, if you're in the Chinese, place, with a bunch of soy sauce that's high in salt, you could get 8 grams of sodium or 8,000 milligrams in a quick meal.
So what is it about salt that affects blood pressure?
Well, look at salt. I know you probably didn't do this when you were young. So, boys, we're always bad when we're young. I remember when I used to see those slugs on the street, I'd go get some salt.
Pour it on there.
When you think about what you see what salt does, salt is a water attractor. Essentially it just pulls water. So if you think about if you ingest a lot of sodium, then normally what you would do when you ingest sodium is it would be excreted through your kidneys and urine. It's like it pulls water into the kidneys and you kind of get rid of it that way. Mm-hmm. But when you look at sodium, it actually holds that water inside the body. So essentially, what creates blood pressure is the amount of resistance in the arteries to flow. When your heart pumps and is pushing against these arteries, it expands the artery, but if the artery has a certain amount of inherent pressure in it, it gets stiffer, it takes more force and pressure to push blood
push the
through
blood
that tube.
through.
So if you have that, then on top of it, you push more water through, then you're going to have a higher pressure load going behind it, which is going to raise that blood pressure up. So when you're, if you cut that sodium back, then of course less water, less blood pressure.
440-2665 or 1-800-940-2240. If you're on blood pressure medication and you want to find out some ways perhaps that you can work your way off, give us a call and let's talk about it. Scott joins us from Chesapeake. Hi, Scott. You're on the air.
Hi. Nice to hear from you.
Thank you.
I wanted to make a comment about something that's overlooked. I'm an anesthesiologist in Chesapeake, and in my practice, I see a very large proportion of people who have obstructive sleep apnea, and that, unfortunately, is a very unrecognized cause of high blood pressure, and we're just now starting to recognize that there's a lot of people who are at risk for it, who are just not what we would consider to be high-risk people. They don't look like the classical sleep apnea patient. Used to be people who were overweight and had large necks and that sort of stuff, but really it can be just about anybody who can be at risk for sleep apnea, and that's a very, unfortunately, common and significant cause of high blood pressure.
Okay, so you're saying the sleep apnea causes the high blood pressure, not the other way around.
That's correct.
Okay. Thanks so much for that call, Scott. I'll get Dr. Newby's reaction.
Well, actually, I've been an advocate of, if you could talk to most of my patients, I've been chasing sleep apnea for about the last 15 years of my practice because I did see the an easy correlation between the two. I originally looked for sleep apnea because of I would get a lot of patients with chest pain would come to the office that had no evidence of coronary disease. We run through all these tests and found out there was just nothing there. But we were finding that some of the other descriptive terms suggested sleep apnea was present. So I started chasing behind that. Then when you start reading the literature, there was a strong correlation of that in hypertension. There's a strong correlation of that with a lot of things. Atrial fibrillation, which is a heart rhythm disturbance. People get a lot of fatigue, tiredness. And it is true what he was saying that a lot of the patients, the typical thought it was a sleep apnea patient was overweight and large neck, all this stuff. But I've got some very thin, extremely thin patients with severe sleep apnea. You just have to kind of take everybody as an individual, and then you have to find out what they're having. That's why it's important to talk to patients. If you really let them talk and listen to what they have to say. One of the things I learned from my brother when I was a medical student, he was a practicing physician. He says if you let a patient talk, you listen to what they have to say, 90% of the time, you'll figure out the diagnosis just by listening.
They'll tell you what's going on.
They'll tell you what's going on. You'll be able to piece it together pretty quick.
So because they call it the silent killer, because you don't feel it if your blood pressure is high and it's constantly high. But what could it do to you if you don't address it?
Well, one of the first things when you think about it is it's putting pressure on arteries. So you think about, just like if you take a road, if you take water and take it like a faucet and you just turned it on and you just let the water pressure hit the road long enough, it's going to start putting a dent in that road. Look at high blood pressure is doing the same thing. It's going to, it's all in the vascular system, so it's going to damage whatever is supplied by an artery can be damaged by hypertension. So you think about head to toe, brain, eyes, you think about, the heart and its vessels. The potentials, and with the brain, talking about stroke, blindness from a visual problem. You think about heart, it can cause what they call left ventricular hypertrophy and heart failure. Left ventricular hypertrophy when the heart muscle gets thick, and then heart failure, can occur kidney failure. All these things that the blood pressure will affect can cause damage to those organs.
Speaking of kidney failure, we have a question from Facebook. It says, is it true that high blood pressure medication affects the kidneys, and that's the reason why so many people with high blood pressure are also on dialysis?
No. Okay. Actually, it's the opposite. It's the hypertension that's actually damaging the kidneys, and so most of the time it's the lack of them taking the medicine is what's getting them in kidney failure. It's not if you look at the data, it's overwhelmingly clear. The higher the blood pressure, the higher your complication rate. You know, the Lord, I mean, I get these people, we go toe to toe in the office with stuff with hypertension and medicine. They give me all this grief. They don't want to take it. I don't feel bad. Why am I taking this stuff? And I'm like, because I'm trying to keep you alive.
And it's that serious.
It's that serious. I mean, people blow this stuff off. And I can understand it, because if you think about you have an infection, you feel lousy. I want to take something to feel better. So you take medicine, you feel better, life's lovely. The problem is with hypertension, because it is a silent killer, because it doesn't typically affect people clinically in terms of how they feel. People's question, why am I taking this stuff? I don't feel bad in the first place. They don't understand these dynamics, which is why we need to make sure we're emphasizing that to patients. So the more you avoid it, the more likely is you'll get permanent damage.
Well, let's talk about medications for a minute, because there's so many different kinds. Once you're put on medication, then there's the adjustment period to say whether this is working for you or if you need to do something else. So what does the medicine do, first of all?
Okay, well, it depends on the class of drugs. There's different classes of drugs out there. You have, like, example, calcium channel blockers, which affect the calcium channels in the vessels. When the calcium channels are enhanced, then you get vasoconstriction. When they're blocked, you get vasodilatation. So the more you dilate vessels. Okay. All right, let me break it down a different way. Certain things affect the vessels and make them constrict, which means it's going to raise blood pressure. Certain things dilate the vessels, which makes them relax and lowers blood pressure. So the calcium channel blocker class will do that. The ACE inhibitor, ACE receptor blockers, those are it works on a kidney level, because really all blood pressure is controlled on the kidney level. And things that affect, and it's not that it's affecting the kidneys adversely. Most people that have hypertension have what they call central hypertension. It's more of a genetic problem. And there is a lifestyle enhancement part of it, but it's a genetic problem. And a lot of people don't understand, though, that the drugs aren't necessarily affecting the kidneys adversely. They're trying to actually protect the kidneys. So you get those types of drugs, ACE inhibitors, lisinopril, those types of drugs. You have this medicine here that has Benicar in it. That's that's an ACE receptor blocker. Then you have the diuretic class, which makes people, go to the bathroom and urinate. That actually lowers blood pressure, because remember I was telling that extra water that's in your system, you need to get rid of it. That's why the lifestyle change makes sense. If you really think about it, if you take a little less sodium, that's less water. A lot of people always say, well, I was told I need to drink more water. And in certain circumstances, that may be true, because what the thought is the more water you drink, that's replacing food, which means you won't gain weight as much, because your belly be full of water. You won't be as hungry. But at the end, and like you hear the old wives' tales about flushing out your kidneys, all this stuff that you hear, it's not so much that. It's just what's happening is water doesn't have sodium. So it's not affecting that. But, the thing is, it depends on what you're doing with that water, and that's what's happening. It's like you can say, for example, like this bottle of water right here. If I drink that, then I go to McDonald's and get a Big Mac and some fries with a bunch of salt on.
You canceled out the water.
Well, what you've done is I'm now going to enhance my blood pressure, because this water is going to get held on to. It's not going to be urinated as quickly, because all that sodium I just ate is going to be like that slug issue where it's holding on to all that water I just had. So I'm really defeating the purpose, and that's where people just don't really understand. It's like if you do one thing healthy, but you do another thing bad, they don't mesh together. So that's what a problem we run into.
So if you take the medication, does that mean you also need to include those other lifestyle changes?
Yes. Because
the medication won't overcome.
Yeah, you can override anything if you try hard enough. You can mess anything up if you try hard enough. The thing is it's a conglomerate of different things you have to do. Health is more than just taking a pill. It's lifestyle changes, things you need to do. Stress reduction. A lot of people may drink a little bit too much. Drink too much alcohol, that can raise blood pressure.
I was going to ask, does that raises high blood pressure?
Well, if you drink too much of it, then that's where you get into this thing about moderation. People say, well, just like people that gain weight, they say, well, I don't hardly eat anything. Well, you're just like, well, what does that mean? define not eating that much, because, somebody else's definition is going to be different. It's a matter of caloric intake, it's a matter of the salt restriction, lifestyle changes, stress reduction. All these things play a factor. And there's not one thing that's going to exclude everything else. It's more of an inclusive kind of thing than it is an exclusive thing. And that's where, you run to that. And I understand this is just kind of how we're trained to think this way of, things are easy if you now with technology. Stuff is so easy now with technology. You do this, you do that. You could push a button, this happens. Push a button, that happens. You take this. I'll get somebody, and I always laugh because I get somebody come in with I can't get them to take a blood pressure pill. Oh, they give me grief with that. They see these side effects and I don't want to take that. And I'm asking, why?
And what are some of the side effects?
Well, it depends. Every pill's a little different. The thing that people that frustrates me is the pharmacy. You go to the pharmacy, they're gonna give you this list of stuff, these side effects. They don't talk about the percentages of people that are going to experience this. I have patients say, I saw these side effects and I'm not going to take it. They're almost like they're thinking if it's listed there, you're going to experience that. Those are potential adverse reactions that you could have if you take this medicine. If you look at what we get as doctors, we get something called a physician's desk reference, and it lists every drug and it talks about side effects, but it gives you percentages. It says, okay, this one, say in these 10 studies, these adverse effects were noted, and they'll say like this one was 10%. Of patients who took this drug experienced this. And the majority of those medicines are going to be somewhere between 10 and 14% is the most you'll see. Sometimes you'll see 20. But majority of the time, it's going to be 14% or less of patients experiencing any of this stuff.
So that means if the rest of the 85% are fine.
And the thing is, but when a patient sees those, I'm not taking this because it said I was going to. No, that's not what it says. It says these are potential side effects, not definitive things you're going to experience. I said, so, the thing is, you're trying to tell me, I'm trying to keep you from having a stroke. I'm trying to keep your kidneys alive. Just understand what the premise is. I say, most of these companies, they're trying to protect themselves. They're going to list anything and everything. It may be less than 1%. And that's where you look at the majority of those side effects. They'll always be less than 1%. And there'll be like 8 million things there. So that's what we run into as physicians.
So with so many people on blood pressure medication, the pricing, does that come into play when you decide what medicine you're going to prescribe?
Yeah, personally, I do, because you find you're going to get fussed out otherwise. They're not going to take it, or they're going to try to get some, and they're going to try to piecemeal it, like they take one every couple of days, and that's not helping anything. Or they'll try to take some little tiny pill and cut it about 20 pieces and say they think that's doing anything, and it's not. So I always take into account costs when I'm prescribing medicine, and because you have to these days. Patients can't afford it otherwise.
But you have to take it every single day if you're on medication.
Yep, or you got to let your doc know if you're doing something different. Because what happens if you don't say anything, then we'll assume you're taking it, and then when you come in, and patients aren't always as forthcoming about things as they should be, and you'll sit there and say, and I've learned the tricks. When I see a pressure, I see somebody and I have a medicine I put them on and I know it should be reducing it some. And I see, and they come back next time their pressure is not 1 iota different. And then I look at them and I say, are you taking this stuff? They say, oh yeah, I'm taking it every day. And I'm like, where's the bottle? Well, I left it home. And I'm looking, I said, okay. Then I go out there and tell my crew, I ask them where they get it from. They'll tell me what pharmacy. I go out there and say, call that pharmacy. Find out last time they had it filled. And then they'll come back, they'll call me and they'll say it was filled 8 months ago. So then I come in there and say, okay, so they say this thing was filled 8 months ago, but you're taking it every day, and you only get 30 tablets. So what are these, like magic bean pills? They just magically pop back in your bottles. You'll never have to get it refilled. I mean, they just, people just aren't always as upfront as you would like them to be. And it's just, this human nature. They don't want to get fussed at. And my thing is, I tell them all the time, I'm not here to fuss at you. I'm here to try to help you. I just don't want you to have a bad event because you don't do what you're supposed to do.
And I mean, from your perspective as a cardiologist, it can hurt their heart.
It can hurt their heart big time. And you try to tell them that, and interestingly, now I know I have to be careful what I say on public radio, but, one of the things that, and this is an important thing to talk about, my men patients, they're worried about impotence.
And you know what? I want to hold that for just a second because we're getting ready to go back to Pledge Central for just a minute. But on the other side, we have some questions about what we should be seasoning our foods with other than salt, so that we can talk about that. And we do want to get into the issue that men face taking this blood pressure medicine. You are listening to Another View here on WHRV, and we're going to go over to Pledge Central to see how we are doing with our matching pledge of $1,200. How are we doing, Sandra?
We're doing really well. Thank you, Barbara, and good afternoon. 889-9476 is the number to call to get in on a little matching action we've got going on. First of all, let me give you the number. We've raised $22,222 so far. That's right. I said 22222. That's
you were dying to say that, weren't you?
I was dying to say that. And a lot of folks have, in fact, taken us up on the match, which means that every dollar is another dollar. So every dollar that comes in this hour is going to be matched up to $1,200. William Cole of Yorktown loves Another View, and he took part in that match. He's a renewing member. Thank you so much for that. And we have a brand new member here. Love the new members. Two new members, actually. Danae and Christian Jones-Acher of Chesapeake. They love all the programming, but they never miss your show, Barbara. So they are brand new members, just signed up, and they took part in that match. So thank you, and welcome to the big happy family. I'm Sandra Woodward, and with me is Dan Cawley.
Hello.
And
I am thrilled to be here. I am a volunteer. I am a member.
And a nice guy.
Thank you very much.
Yeah.
Give you your nickel in a minute.
Okay.
And I am here on Pet Pledge Friday, asking you to join me as a member here on WHRV. Call now if you've never joined before. This is a great opportunity this spring, a 1-week quick express drive we've got going here. Call 889-9476 or go online at WHRV.org and point, click, and pledge. Tell us about your pets. Tell us about your favorite programs. Tell us how much you enjoy listening to Barbara Ham Lee every Friday.
And Dr. Newby when he's on.
And Dr.
How awesome is he?
I've been taking notes, quite frankly. And we've been talking about the discussion because that's what this show does. And that's what this whole station does. Most of us who listen to these programs regularly, we listen to it with a notebook. We write down books that we hear about or movies, or we write down notes and thoughts and quotes. And we learned about analogies earlier today, and in an exciting and interesting way, believe it or not. And now we're learning about important health information. You don't get that anywhere else. You might get a song or two and a whole bunch of crazy commercials. Here, 3 weeks out of the year, they interrupt to say support. And I'm asking you to join me as a member and call 889-9476, 1-800-940-7170. And in the next 3 minutes, we need 5 people to call because of this match. Sandra, tell us about this match.
It's $1,200 essentially is what is the matching amount that we have. So every dollar that comes in up to $1,200 is going to be matched. So come in at the $48 level, boom, it counts twice. Come in at the $120 level, boom, that counts twice.
Thank you for that call. There's a boom right there.
There's a boom.
There's another boom.
889-9476 is the number to call, so you can take part in this match where your money counts double. It's basically free money, is what it is. It's free money.
And instead of lowering the boom, let's raise the boom.
Okay.
Let's get the boom. And remember, let us know your pets, because we've got 91 cats, 76 cats, 91 dogs, 2 sugar gliders, and a rabbit.
Yes, a rabbit. I'm all about the rabbits.
Because Pet Pledge Friday, if you're new to the station, it's a great tradition. It's been around for years. People call up and they talk about their pets. The studio here is filled with these beautiful dogs and animals here, and great volunteers waiting to hear from you. This is how it works. We're listeners. We're volunteers, and it's up to us to support public radio to make sure this programming is still here. So join me right now, 889-9476, 1-800-940-7170. Sandra, you've got quite a few new members. Merlin Cavalin and Shay Capehart from Hampton, new members for WHRV. Jennifer Parker from Norfolk, a new member for her shop dog, Bubba. Christopher O'Brien, a new member for WHRO. Challenge listeners 35 and under to join. Ashley Rangel from Portsmouth, a new member in honor of Weeper, the backyard hen.
There's a call.
Thank you for that call. If you've never contributed, join me now.
889-9476, 757-889-9476. WHRV.org is where you can point, click, and pledge. Your dollars are being matched at this hour during Another View. You're getting great programming. You're getting award-winning host, Barbara Ham-Lee. You're getting award-winning producer Lisa Godley, bringing you Another View for our listeners here in Hampton Roads. Great interviews, great stories, all made possible by our members. You are the public in public radio. You are what makes this great conversation that you're hearing right now with Dr. Newby happen. If you love this show, invest in it. It's a very simple thing to do. You go to the phone and dial 889-9476, and immediately you're going to get 100% return on your investment because your money is being matched dollar for dollar during this hour.
Thank you for that call.
Take advantage of this now. It's Pet Pledge Friday. It's the final hours of our Pledge Express, and we're looking for calls right now, like that one right there.
Thank you for that call.
757-889-9476. That's the number to call. We'll set you up with your membership, set you up with your renewal. You can do it online too. WHRV.org. However you do it, we'd love to hear from you. Now we're going to take you back to what you're paying for. Great programming like Another View. Take it away, Barbara.
Thank you, Sandra and Dan, and thank you to all those calls. It just warms me and Lisa's hearts to hear those phone calls coming in during Another View. So if you love Another View, please dial 889-9476. Now, Dr. Newby, let's get back to our discussion. We're talking about hypertension and high blood pressure and how to avoid it and how to deal with it if you have it. I am one of the millions of people who do have high blood pressure, or hypertension rather. Let's use the correct terminology. And we were getting ready to talk about the effects of medicine. And one of them, and I hear this from men, is I'm not taking that blood pressure medicine because...
They always say the same thing. Is erectile dysfunction is the big buzzword of this next millennium. One of the things I wanted to bring up with that, just briefly, a lot of men have this idea that if they take the medicine is actually causing a problem. And to a certain degree, it can be. But what a lot of men don't realize, and why I wanted to bring this up, there are two separate studies looking at this question. One in the last, in 1998, one in after 2000. And what the one in 2000 showed was that when they looked at this issue of erectile dysfunction, they said despite medicines that they may be on or not on, 68% of men eventually develop erectile dysfunction. And that's like if they weren't on any medicine, they were still potentially getting it. Mm-hmm. And I try to explain that to patients to say, listen, if and the thing about medicine, say if you're on the medicine and it's causing a problem, well, you change the medicine, you haven't evoked any major damage of any kind. But a lot of patients don't realize that they're not taking medicine. The erectile dysfunction could become permanent, because they're not taking the pressures too high, and it causes, again, you're talking about damage to vessels, which means you're damaging those end organs, meaning where those vessels are leading to, whatever is at the end of that vessel is going to become damaged as well. So when you're talking about erectile dysfunction and men in hypertension, you'll find that if you aren't on medicine, if you're not taking anything at all, and you let your pressure just stay high, eventually that will take you down, so to speak, and unfortunately so, it may in fact be a permanent change versus medicine where it's a transient. You change the medicine, find something different, life's lovely. But if you don't be careful, it can really
Have there been
things.
Studies on people who are on blood pressure medication for long periods of time? Is there any problem with that, or it really does just help? It doesn't damage in any other way.
I mean, I think if the key thing has not been so much the medicine, but what's the end result? Meaning, if you reach the target pressures you're looking for, that's really where the studies have been showing that there's any issues. Because if you're on high blood pressure medicine, but you never reach goal, meaning, get those numbers where they need to be, you're still going to reach some of the end organ damage, but it may not be as fast if you're on medicine. Meaning, say like if your pressure is 180 over 100 on an everyday basis, then you're likely going to create more damage there than you will if it's 140 over 90. But, what people don't realize is, let's talk about stroke real quick. Stroke risk, and and just so people understand what a stroke is when you actually affect blood flow to the brain, and that could be either ischemic, meaning you have lack of blood flow, or hemorrhagic, meaning you bleed into the brain. Any event, the end result's the same. You have some effect of your neurologic function. Either one side is weak, or your voice is affected, meaning your mouth gets twisted, whatever. A lot of people look at different manifestations of stroke. And a lot of people don't realize that if your blood pressure is 140 over 90 and you stay that way, your risk for stroke is 4 times the normal population at 140 over 90.
Is there a number, because Lisa just sent this question, is there a certain number that triggers the heart attack or stroke?
No. Actually, it's a chronic problem. This is where things just happen.
So it still needs, when that event happens, you've had that blood pressure at that level for a long time.
Characteristically, things in medicine you will find, the reason why they call it the practice of medicine, because it's not anything that's set in stone. Everybody's a little different. I've heard patients would come to me and they change cardiologists because they say, the doctor did a stress test on me, and next day I had a heart attack. Therefore, he did not catch something. I'm like, you got to look at it this way. You're diabetic. You got high blood pressure. You really ain't exactly doing what you're supposed to do on your end. How that wasn't the reason? Because people don't understand that even like a stress test, you do a stress test and you're looking for coronary disease or blockages. You can have, say, a 20% or 30% blockage, and that will not affect any abnormal flow to the heart. Because look at the arteries are like highways. Look at, say, if you go, I don't know if you've ever been on 85 into Atlanta. I lived in Atlanta for 3 years, and I was a resident many moons ago, and people drive crazy going to Atlanta. It's like they're going like 95 in a 60s mile an hour zone, but you have like, say, 5 lanes going to the city. If I block up 2 lanes or even 3 lanes, if everybody does not rubberneck and they just drive, the flow of traffic will not be affected. But once you get to that next lane, then all of a sudden you're starting to bottleneck. Well, the arteries in the heart or in the brain are the same way. You need to affect a significant amount of blockage to cause a problem. And I say all this to say this. What causes heart attacks and strokes are sudden occlusions. So if you have, say, like a 20% blockage and something happens to that blockage where it erodes and opens up to the bloodstream, which a lot of times that plaque would do because it just ruptures and goes and opens up to the bloodstream, where the body senses that as an injury. Platelets, clotting factors get activated and all go to this area, but you're talking about a hollow tube, which is a blood vessel. Stuff has got nowhere to go. So once it fills that tube, it's going to stop up. So when you have that scenario, that's what causes the heart attack. So I can do a stress test on you today and it'd be fine. You can go out tomorrow, rupture a plaque, and get flow in clotting mechanism, have a heart attack the next day. That has nothing to do with what was there the prior day. That's a totally different scenario, and that happens minute to minute, day by day. That's why we emphasize those risk factors like high blood pressure, diabetes. If you get those things under control, then your risk of going on to rupture that plaque is going to be a lot less because you're taking away the emphasis that otherwise would cause those plaques to occur.
440-2665 or 1-800-940-2240. We're talking about hypertension, and we're about to talk about ways to prevent it. So give us a call. Join our conversation, 440-2665 or 1-800-940-2240. So what can we do to prevent high blood pressure, hypertension in the first place?
I think the first step is always identification of what's your level of risk, meaning if you have to start looking at your family history, and you really want to look at first degree relatives. If you're let's say mother, father, brother, sister have hypertension, that's going to put you at risk. That doesn't mean you're going to develop it; it just puts you at risk. So then you have to say, okay, what's my risk? And then you have to say, okay, what's my blood pressure? You have to actually check it, which means you have to go somewhere and let somebody take a look at it.
And should you, I know that they have those blood pressure machines like in the grocery stores and so forth. Are they reliable?
Relatively speaking, I think so. To
give you a general sense.
And I think most of them are actually pretty good. There's some a little bit better than others, but I actually like a lot of those automatic cuffs. They actually are pretty good. You just have to be careful when you do one because it could be, you can get one number that looks a little off from what you normally would see. And that's why it's always good to get trends, because if a number is off, that means you just check it again. Just check it, a couple minutes later, see what it is, because sometimes it may look a little off the first time, but, it may have been something happened. If you had like a skip beat in your heart, the cuff may not be able to interpret that skip beat, and it may give you a number that seems falsely high or falsely low. So sometimes it's good just to get another check, so you can kind of get a correlation, and you look at trends. Everything is about trends in medicine. What was it the day before? What's changed with you? And what did you have to eat that particular day? If you talk about a high sodium meal, that's more problematic.
Okay. So we said find out about your family history, get your blood pressure.
Check.
Then what?
Then there's going to be risk factor reduction. Meaning, if you got to start looking at sodium content. If you look at the American Heart Association, they have this diet called the DASH diet. It was designed specifically looking at how to control hypertension, and I'm an advocate of it because it really talks about sodium restriction, what you should look for. A lot of people say, well, I'm reducing my salt, I'm watching what I'm eating. I'm like, well, what does that mean? Tell me, how are you watching it? Are you counting the actual amount of sodium you're eating, or you just say, well, yeah, this looks all right, let me eat that? If you're just doing that, then you'll never know what you're actually consuming at the end of the day. You need to count that stuff.
So they can go to the American Heart Association's website for the DASH diet to find out some other ways, and also how to make food taste well without salt, right? 440-2665, 1-800-940-2240. Bonnie joins us from Chesapeake. Hi, Bonnie, you're on the air.
Hi there. Thank you so much for taking my call.
Sure.
Although we all try to be very good about taking our medication, what would happen to your system if you forgot your pill just one day?
Well, if it's a once-a-day pill or a twice-a-day pill, depends on the formulation. But to answer the question, if, say, like you totally forgot and you went to sleep that night, next day you said, man, I didn't take it the next day, my personal opinion, I would not double up the next day. I would just get back on your medicine and just take it once a day thereafter. You won't necessarily injure anything by missing it that day, but you don't want to make that a pattern.
Okay, thank you so much. I appreciate it.
No Thank problem. You, Bonnie. Thanks for the call. We appreciate it. 440-2665 or 1-800-940-2240. Robert joins us from Williamsburg. Hi, you're on the air.
Okay, thank you. Thanks for holding this. Recently I came upon a study that was endorsed. They've actually a couple of longitudinal studies endorsed by the American Heart Association, and they were looking at the effects of people that did meditation. And in particular, studies they were looking at transcendental meditation for people that did it in excess of 5 years, and the effect on the cardiac health. So they're looking at different parameters, including blood pressure, and then they were longitudinal studies, and they showed some pretty drastic results, which to me would imply that that's something that we have control over rather than just going to a doctor and getting a pill. And I was just trying to get some feedback on what the cardiologist, if he was aware of that and what he thought of those studies.
Okay, thank you, Robert, for the call.
Yeah, that's that's not really not new data. I mean, a lot of times people rehash the old data to make it look new, but there's studies been out talking about meditation, prayer. There's a lot of potential ways of doing it. Essentially, all you're really doing, again, that goes back to my initial comment about lifestyle change. If you're meditating, reducing your stress, and I believe in that data. I mean, I 100% believe in it. Mm-hmm. But again, that goes back to what I was saying, that it's not just taking a pill that does it. It's a lifestyle change. It's everything. It's just not just taking the medicine, or it's taking the medicine potentially as well as these other things. That's why I think you asked me the first steps. Mm-hmm. You always want to change lifestyle first, at least in my opinion. Unless the pressure is really ridiculously high, then I'll just say, well, let's try to do it combination wise of doing medicine and risk reduction. A lifestyle change, and then if the pressures are coming down dramatically, then maybe we can look at coming off medicine.
Okay, we've got about 3 minutes left. Let's see if we can get one more call in. Beth joins us from Virginia Beach. Hi, Beth, you're on the air.
Hi, Dr. Newby, I had two quick things I was hoping you could address. The first one in regards to the use of antidepressant medications, and if they can have an adverse effect on the blood pressure, and also in regards to TIAs and how reflective they are on a person's hypertensive condition.
Okay. Well, TIA is a transient ischemic attack, so it's just like a mini stroke.
Thank you, Beth.
And there's a strong correlation between the risk of stroke and hypertension. So if your pressures are poorly controlled, of course, your risk for TIAs go up significantly. And I always look at a TIA as a potential blessing from the Lord above, who's trying to say you need to change something, and it's giving you, because TIA means it's transient, means it goes away, so you get complete recovery within 24 hours. So that's telling you something's wrong. So there's really a clear need for that. Mm-hmm. In terms of answering the question about antidepressants, I mean, it depends on the antidepressant. There are some that may adversely affect blood pressure, but that's not something I've seen on any strong correlation between the two. Most people on antidepressants, they had hypertension anyway. I haven't necessarily seen it made worse with that.
Mm-hmm. Is there a point in time where you could get a number where you would immediately send someone to the hospital?
Not really. To be honest with you, I mean, I had some people come in the office at 220 over 140. I mean, and they feel totally fine. I mean, well, the first step to me is, I look at the symptoms are what drives the admission. If they're having shortness of breath, if they're having visual problems, neurologic, kind of issues, then they need to immediately go. Chest pain, things like that. But just the blood pressure itself, it's just you need to be aggressive in treating it, though.
Mm-hmm. Okay. And so the bottom line is, if you're on the medication, take it.
Yep.
And if you're whether you're on it or not, change your lifestyle.
Exactly. And I think the conversation needs to occur with the doctor, and in terms of if you want to come off medicine. A lot of people think, well, if I'm on it forever, and that's not always true. One thing I wanted to do real quick, if I may, for 2 seconds, I wanted to kind of make this comment. One of the things that I know when we kind of put this show together was making sure we're addressing the needs of the community. And I wanted to kind of reach out because I know I can't get feedback as to whether or not this is helpful to people or not. So one of the things I like to do is I wanted to put an email address out there to everyone to say, if you could give me feedback, I'd like to know whether, number one, is this helpful? Secondly, if there are topics that would be of interest that people want to hear about, I'd like to make sure we're addressing those needs.
What's that email address?
That email is k.newby. That's k.newby at fortnorfolkmedical.com. That's Fort, like F-O-R-T, and then it's all this is one word, no underscores or spaces. FORTNORFOLKMEDICAL.com. So k.newby at fortnorfolkmedical.com.
k.newby at fortnorfolkmedical.com, or you can contact us at WHRO.org or anotherviewradio.org and let us know whether or not this is helpful, and also what topics you'd like to talk about. Dr. Newby, we'll see you next month. Thank you so much.
Thank you.
And we'll be right back.
Hello, this is Spike Lee. What's happening? And you listen to Another View, 89.5 FM on WHRV.
Thank you, Spike Lee. Recently, WHRO recognized 3 people in the Hampton Roads community who are considered pioneers in public broadcasting. It was the WHRO 10th Anniversary Pioneer Awards. One of this year's awardees is Jack Ezzell, a Hampton businessman who has a true passion for education and children. Our Lisa Godley sat down with Jack and found out why, according to one of his friends, he's one of those people you want to have on speed dial.
But the thing that motivates me more than anything else is giving back to others and working.
It's that frame of mind that keeps Hampton businessman Jack Ezzell very busy.
For a long time, we had a nonprofit here that I sponsored called Kid Tech. And what we did is we provided free computer training to kids and senior citizens. That was early on when the digital revolution was just taking place. So we'd have kids come in after school and we'd teach them the basics on how to use computers. Really great.
He credits his desire to reach out and make a difference in the lives of others to his father.
My father was a wonderful man. He was a community organizer. He worked in a lot of anti-poverty programs in North Carolina, and he taught me the value of giving back.
A graduate of North Carolina A&T State University, Jack joined the military and retired as a U.S. Air Force colonel. He then founded Ezzell Technologies, one of the nation's leading professional services and engineering firms. Jack's good friend Henry Light describes Jack as a man who has an amazing ability to make change in the world.
He has a sense that he can make change in the area and the state, and he's willing to work on making change. A lot of people sort of give up and say, can't do much about that. But Jack seems to be willing to put his nose to the grindstone and go in there and work on these issues.
Former WHRO board chair Anita Poston describes Jack as someone you can always count on to give sound advice.
The breadth of his experience in the community with community organizations and with his business just gave him an enormous savvy about human nature.
Jack's wife of nearly 50 years, Linda, says her husband has a passion for public broadcasting.
He loves WHRO Public Broadcasting. He loves their online education. He's changing what I'm listening to. It has to be NPR.
Jack Ezzell spent close to a decade serving on the WHRO board.
One of my fond memories is really deep diving and getting involved in education, because education is very big to me. So the online offerings that the WHRO has are just marvelous. So I immerse myself in that kind of thing.
His passion to see students be the very best they can be has spread throughout the Hampton Roads community, from spending what free time he has reading to preschoolers to taking the time out to mentor older kids.
So what I really do is I try to go one-on-one from a motivational standpoint with the kids and get them to understand the consequences of the decisions that they make and the importance of education.
He has also served on the board of the ARC of the Virginia Peninsula, an organization that helps people with disabilities live, work, and thrive right here in Hampton Roads.
Very, very rewarding. I can go in to the Peninsula ARC and walk in the door, and I'll see someone who says, "Mr. Jack, how are you today?" And this is someone who society has pushed off to the side, okay? And they just want to give back and do things. So for me, the chance to do that is just a rewarding piece of my life.
He loves those kids. He loves watching them develop. He loves the downtown Hampton Child Care. He was on their board, and when he got off, he put me on.
Another of Jack's longtime friends, Regina Brayboy, describes him as the kind of person you want to have on speed dial, a go-to person who can help you strategize something you might be mulling over.
He's an excellent listener to whatever it is that people are bringing to him, and he's just a very thoughtful person, and I appreciate that so much about him and his personality.
For Another View, I'm Lisa Godley.
And we want to say congratulations to Jack Ezzell and also to Buzzy and Joanne Hoffheimer, who also received Pioneer Awards. Time now for things to view and do in Hampton Roads.
You will be my Saturday love.
The YWCA Southampton Roads invites you to attend the Stand Together Against Racism panel discussion tonight, Friday, April 26th at 5 at St. Patrick Catholic School, Bowling Avenue in Norfolk. The topic is achievement standards based on race and background. Are they beneficial to all students? Call 625-4248 for details. Empower Hampton Roads celebrates its 10th anniversary spring banquet on Sunday, April 28th at 5 at the Murray Center, East Brambleton Avenue, Norfolk. The keynote speaker is Catherine McFate, President and CEO of the Center for Effective Government. Call 237-5326 to find out more. The I Dream to Lead essay contest and scholarship is accepting applications. The contest is open to all currently enrolled post-secondary bound high school seniors in Hampton Road who qualify for free and reduced lunch programs. The top 2 essay winners will be eligible for a $2,500 scholarship and a chance to attend the Lead Hampton Roads Excel Summer Program. The deadline to submit your essay is Wednesday, May 1st. Call 664-2516 to learn more. And the Friends of Hampton Roads invite you to And They're Off, a Kentucky Derby celebration celebrating 25 years of serving Hampton Roads. It's Saturday, May 4th from 4 until 7 at the historic Obacy House in Suffolk. Don't forget to wear your derby hat or brim. For details, call 816-0706. These and other events are on our website, anotherviewradio.org. When you visit, you can stream any previous episode of Another View, sign up for our eView newsletter, a once-a-week reminder of upcoming upcoming programs or send us a note to tell us how we're doing. Next week, a very special interview with fiction writer Omar Tyree. We'll find out about his new career direction. And our special thanks to all of you who have made your pledge of support for Another View. Don't forget, we have a challenge. If you pledge before 1 and you've got about a minute left, we will match your pledge up to $1,200. For producer Lisa Godley, audio engineer Perry Smith, Kendall Hairston, who answered our phones, I'm Barbara Ham Lee. Have a fabulous weekend, and let's get together again next Friday at noon for Another View.